how you going? I'm Chris. Nice to meet you.
Nice to meet you too, Chris.
What brings you in today?
I've just hurt my right knee, as you can see. I hurt it a couple of days ago playing basketball with a friend.
Yep.
We were just down the court having some practice shots, and I went to change direction really quickly, chase the ball.
Yep.
And I kind of buckled over my right knee, fell on my face.
Yep.
Really hurt when I did it, and it hasn't got any better, so I'm not sure what I've done. So I thought I'd better come see you.
Okay.
Pretty swollen, as you can see.
How'd you do it? So your foot was planted?
Yeah, my foot was planted,
Yep.
And I changed direction the opposite way.
Yep.
And I just kind of felt it fall over the front of my knee, and it really sharp pain, a little click at the same time, or a pop maybe.
Yep.
It was really, really sore when I did it.
How's it been since you've been able to walk on it, or?
Not at all. It's got no better. I've been taking some Panadol for it. I haven't done anything. It's pretty sore.
Yep.
Yeah.
Alright, we'll take a look. There's a bit of swelling there I've noticed. So
Yeah.
jump up on the table
Yeah.
and I'll do some tests, and yeah, we'll see what's going on. So
Cool.
jump up, mate. Alright, John, so I'm just going to be doing a few tests just to test stability of your knee and testing all the ligaments. So these ones here, we're testing for your ACL to see if that's been torn or unstable at all. So first of all, I'm just going to be, that's painful. Yeah, got a bit of movement there, so that's bringing the tibia forward on the femur. That's a positive test for ACL. I'll just test the PCL at the same time, so just press posteriorly.
Yeah, that's alright.
That's okay?
Yeah.
Yeah. Alright, John, so just going to be doing a test here, test for ACL deficiency as well. So just let me know, you might get a bit of movement with your tibia here. So I'm going to bring you into flexion there. And there we go, that's drop posteriorly, the tibia there.
Yep.
And then as I bring it back into extension, yeah, that drops back into position. So that's a positive test for ACL.
Yep.
Alright, so I'm just doing another test here. This is more specific for ACL.
Yep.
So I'm just trying up. How's that?
Yeah,
painful?
that's sore.
So got a bit of movement there.
Yeah.
That's a positive test for ACL.
Yep.
Alright, so I've got a few positive tests there for your ACL. I'm just going to test some other ligaments here. So testing the collateral ligaments. So here, yeah, that's
tender.
painful there. So that's testing your medial collateral. There's a positive test there. And the lateral, how's that?
That's okay. It's just a bit sore on the outside where you're pushing.
Okay.
That's alright.
Alright. Thank you. Alright, so next I'm just going to be testing just some meniscal irritation here. Let me know if you get some pain in the knee.
Yep.
So I'm just going to be bringing you back down to extension.
Oh.
How's that?
Oh yeah. Yeah. That one's okay.
That's alright. So I've got a positive test for a medial meniscus there.
Yep.
Sometimes occurs with ACL injuries that you get meniscal damage as well, so that's quite common.
Okay.
Alright, so I'm just doing another test here. It's a test for ligaments around the knee, also the meniscus. So I'm just going to be pulling up on your tibia here.
Oh,
and just testing like collaterals for ligament damage.
Oh.
And if I just compress the knee there, pushing down. How's that?
Oh, that one hurts.
So that's
It's a bit sore as well.
positive for some meniscal damage there as well. So it's got positives in both aspects there.
Yes.
Alright, John. So I've come up with a few positive tests there for ligament damage in your knee. So I think you've done a ACL.
Oh, really?
And possibly some meniscus and other ligament damage.
What's that? And what's an ACL?
Okay, well I've got a poster here, so just want to take a look. Alright, so here's your ACL here. It attaches from the anterior portion of the tibia to the femur. So it looks like you've done some damage to here, and you see how this is attached to the medial meniscus there. So that's why these two can be injured at the same time. Same with the collateral ligaments on the side here.
Oh, well, that doesn't look so good, does it? What do I do? What do I do now?
So the next point of call is we're going to send you off to the GP. We'll get some scans. There's probably a fair bit of ligament damage here. So if you want to get back to sport, because I know you like playing your basketball.
Yeah.
So it's probably a good idea to see GP, refer you off to a surgeon, and looks like surgery may be an option for you.
Okay. All right. Yeah. Definitely want to get back to basketball. So
yeah, definitely.
probably send off to the GP then. Looks like it.
All right, sounds good.
Cool.
Thanks, John.
No worries.
Okay, John, from the referral letter here from Dr. Chris and the swelling that I can see in your knee, I totally agree that the ligaments of your knee need to be imaged better, so we're going to send you off for an MRI.
Okay, yeah.
From there, we'll get the results back, and then you've got two options.
Okay.
If the ACL is ruptured, you can opt for non-surgery as a treatment method where we'll just strengthen the muscles that support the knee joint.
Okay.
However, if you're going to want to play sport, I'm pretty sure Dr. Chris went through this with you.
Yep.
You are going to more than likely need a surgery.
Yeah, well, I want to play sport. So.
Okay. Well, then I'm more than happy to refer you to an orthopaedic surgeon who can further assess it and get the surgery done for you.
All right, we'll have to get an MRI done then.
Let's do that.
All right, thanks.
Alright, John, I've had a look at your MRIs and it's showing me that you actually have done the ACL, the medial meniscus and the medial collateral ligament, or the unhappy triad, as we call it. So from here we do have a couple of options. We can go surgery or non-surgery.
Yeah, right. I don't really want to have surgery. I haven't had surgery before, so I'd probably prefer not to. Can I do that?
Well, I highly recommend you do have surgery. As you said before, you do want to return to sport, and it's basically impossible to play any sport and change direction without your ACL.
Oh.
Yeah, and your growth plates have fused, and you don't really want to live a sedentary lifestyle for the rest of your life.
None at all. I'm pretty active, so especially when I get back to my sport, so I think I probably should have surgery then.
Yeah.
Is it a risky kind of thing to have done, intervention?
There are a few risks involved, John. Just general surgical complications, bleeding, bruising. You know, might have to have another ACL reconstruction if all goes to fail, but these are highly likely.
How long will it take me to get better? Like, is it a long time, or is it does surgery make it quicker?
Before returning to sport, John, it usually takes about 6 to 12 months before you can get back. Yeah, and that includes having weekly manual therapy and rehab.
Is that with Chris?
Yeah, that will be with Chris.
Right. So I won't be able to return to sport if I don't have the surgery?
No, you won't, unfortunately.
Looks like I have to have it then, don't I?
Yeah.
Okay. Alright, where do we go from here then?
Well, basically I'm just going to run through what's involved in the surgery with you and a little bit of the risks post-surgery.
Alright.
So what we do in an ACL reconstruction, John, is we take a graft from somewhere to replace that ACL that has essentially ruptured.
So that's the ligament?
Yeah, that's the ligament, yeah. So basically we either take the graft from the patella at the front here, the patella tendon, a combined graft from the semitendinosus and gracilis tendons down there, or we can take one from a cadaver. Usually we tend to take them from the semitendinosus and gracilis tendons because a lot of patients do present with post-surgery it can have some patellar tendonitis associated, and that can contribute to instability in that same injured knee.
Whatever you say, yep. Sounds good.
So basically after we've taken the graft, John, it's just keyhole surgery, so there's going to be minimal scarring.
Yep.
We're just going to go in there and join the graft anteriorly, anchor it, and posteriorly where the ACL would run.
Yeah,
just
like kind of fake one.
Yeah.
Right.
And then close it up, clean out the meniscus, and the MCL should be right.
It's painful? It's pretty...
Yeah, you will have some swelling after it, and there will be...
It'll take 6 months at least.
Yeah, before you can actually return to start sport-specific training.
How long will it take me to get in for surgery? Will it be soon or...?
Well, I'll send you off to Chris to do some prehab.
So back to Chris first?
Yeah, back to Chris for just a couple of weeks.
Okay, yeah.
And then you'll come to me and we'll do the surgery.
What's prehab?
Prehab, so basically I just want Chris to maintain and get maximal range of motion as possible before surgery.
Yeah.
So then when you come to me, there's more to lose, if that makes sense.
Make sure it's in the best condition it can be.
Yeah, that's right.
Okay, that makes sense. Yep, alright.
But there is risks associated with the surgery. So basically, afterwards, you're more likely to do your contralateral, so opposite side ACL, than that one. So we'll make this one nice and tight.
Would that one be stronger?
Yeah, this one tends to be stronger, whether that's from compensations on the other side or whatnot.
Alright, yeah. Well, look, I haven't really got an option, do I? Because I love my basketball, so I'm going to get back, and I suppose we'll go ahead with that process.
Alright, well, I'll send you to Chris and see you in a couple of weeks.
Cool, thanks.
Hey John, welcome back. Nice to see you.
Yeah, good to see you too.
How'd the surgery go?
Pretty good, I think. They said it all went well. I've just got this stupid brace on now though, which is quite annoying, but I think the surgery went well. They told me it went well, so that's all I know.
Yeah, we need that brace on.
Yeah,
obviously need it.
It's quite sore though, it really hurts.
Yeah, so you got a fair bit of swelling there.
Yep.
So what we're going to try to do today and in the next week or so, we're going to try to reduce that swelling.
Yep.
I'll do some lymphatic work on your leg, just trying to improve the fluid flow, get rid of that swelling. We're going to try to decrease the pain you got going on there.
Yep, yeah, it's really hurting, so...
And then with this brace here, so what they've set it up to do is try to maintain as much extension as we can.
Okay, yep.
That's
why it's in this, yep.
And I'm also going to, I'm going to be working just on your passive range of motion.
Yep.
Trying to get as much motion coming into the knee without you activating your muscles.
That would hurt, yes.
Okay. And then I'm also going to be working just around your hips and everything, also on your opposite leg. We're going to be trying to, because you're going to be walking on that.
I've been hobbling on that leg all the time, so...
So we're going to try to, reduce the amount of work on that leg as well.
Alright, cool. That sounds good.
Alright John, so long term, with your rehab program, so we're thinking more now like 6 months and beyond.
Yep.
We're going to try to get you back to sport, so that's your aim. That's what we're going to try to do. So with that, we're going to have this brace off by then. We're going to be doing as much active strengthening as we can.
Yep.
Working on that strength. And then we're also going to be working on your opposite leg because that's going to be taking a lot of the brunt, sort of up to there. And then hopefully, we're going to try to get you to follow this rehab program. It's really important that you follow that, stick to it, because that's going to be essential in getting everything firing properly. So
if I get this rehab program underway and stick to it all, how long do you think it would take me to get back to basketball?
So thinking anywhere up to 12 months, but it just depends how sort of well you follow this program.